Welcome, everyone. I know that people are still coming into the Zoom room, but since it's 11, I thought I would get started with the intro. Um, Welcome to today's webinar. It is part of the Rural Health webinar series, which runs from November 6th through 21st. My name is Nora, and I'm a health professions outreach specialist at NNLM. Since some of you may be first-time attendees at an NNLM webinar, let me tell you a little bit about us. We are the network of the National Library of Medicine, also known as NNLM. As the name suggests, NNLM is part of the National Library of Medicine, which is part of the National Institutes of Health. We're the education and outreach arm of the National Library of Medicine. We work regionally, getting to know our communities on the ground, and we also work nationally to advance the health and well-being of everyone through access to and understanding of health information. We periodically provide funding to organizations, including healthcare organizations, academic institutions, nonprofits, and libraries, so that they can work within their own communities. And we offer a wide range of training and education opportunities, such as today's webinar. I encourage you to visit nnlm.gov or nnlm.gov/training to learn more. Today's webinar is Promoting Walking for Health in Rural Communities. Our guest speaker is Cindy Perry. She is the Elizabeth N. Gray Distinguished Professor at Oregon Health and Science University School of Nursing in Portland, Oregon. She holds a PhD in nursing science from OHSU, MSN for Family Nurse Practitioner from Yale, and BA in Anthropology from Northwestern. Her research focuses on physical activity promotion across the lifespan as an avenue for reducing health disparities. For over a decade, she has been working within rural and Latino communities using community-based participatory research to develop and adapt physical activity interventions that are meaningful and sustainable, and has evaluated them with mixed method analyses. She also has experience in dissemination and implementation research of public health programming in rural communities. She works with national multidisciplinary research teams and networks in addition to rural communities. She's a family nurse practitioner and has practiced as a family nurse practitioner in various settings, including rural Oregon and Alaska. She was named Yale School of Nursing Distinguished Alumni in 2017. Dr. Perry is a fellow of the American Heart Association. Thank you for being here, Cindy, and with that, I will hand this over to you.
Okay, thank you for that lovely introduction. Here I'm going to share my slides. Oops, let me get it to the beginning. Okay, so first, welcome everyone. Thank you for taking time to come to this webinar. And what I'm going to do is first give a little bit of background information, and then I'm going to describe a project I worked on with walking groups for cancer survivors. And then I'm going to talk about a current project I'm working on, which is working with rural libraries in Oregon on implementing walking groups. And I'm planning to leave time at the end so we have time for questions and discussion. So to start, rural residents, and some of you being part of this network may know, rural residents have higher rates of obesity, diabetes, heart disease, high blood pressure, and certain types of cancer. And we do know that physical activity can reduce the risk of these chronic illnesses, as well as improve the chronic illnesses for people who have them. For example, physical activity can improve glucose metabolism, as an example, helping with diabetes. But rural residents are less active compared to urban residents, with less than 20% of rural residents actually meeting the U.S. physical activity guidelines, which are 30 minutes of moderate to vigorous physical activity at least 5 days out of the week. Now, walking is the most common form of physical activity, people who walk are more likely to meet the physical activity guidelines. And as we know, walking, you don't need any special skills or equipment. You can really do that in many places, indoors or outdoors, really most times of the year. But we do see that rural residents are walk less, whether that's for transportation, for recreation, or exercise, than urban residents. So group-based walking programs are an evidence-based strategy that do increase physical activity and fitness among the participants, as well as improve health outcomes, just as I was describing with chronic illness and such. And one avenue of why they work is that they are promoting, you build social support among group members. There's a certain sense of camaraderie, connection. There's some sense of accountability to the group. And that's really what helps promote maintaining walking over time. But many of these evidence-based programs, just like walking groups, don't achieve their intended population outcomes due to challenges in implementation. And we see, particularly in rural communities, there's also a lack of capacity to be able to deliver these programs. So we did try to address this issue first with this study that was called Step It Up Survivors. And this project was, what we did here is we provided capacity building to organizations by giving them small grant funding as well as some technical assistance for them to implement a group-based walking program for cancer survivors, their family and friends. What we did is we leveraged the Knight Cancer Institute, which is part of OHSU. They have a community partnership program. It's a small grant funding for community organizations. And we put out a special call for developing a walking program for cancer survivors, their family and friends. And so that included $15,000 for the year of the funding, as well as technical assistance. And that funding went from January of 2018 to that December. And the walking groups were implemented for 6 months from April through September. So what we did is we created a user-friendly toolkit. By first, we identified the core elements of a walking program. That is what makes it effective. So I was talking about the group connection. So there's specific parts of the program that is what makes it effective, as well as key characteristics to tailor to meet the unique needs of cancer survivors. Then we adapted an existing action guide for establishing community-based walking programs that was produced by the Partnership for Prevention. So we took that guide and sort of trimmed it down and adapted it. And our adapted toolkit then includes 7 steps, which you see here. And in the toolkit, we provided information on how to achieve each of these steps, sort of month-by-month timelines for completing the steps. And the walking groups met for an hour, and there was a volunteer who organized and led the walking groups. So we saw our role as really a partnership between the community organizations, the School of Nursing at OHSU, and then the Knight Cancer Institute. And so we worked closely with the organizations to help them complete each step and implement the Step It Up Survivors program. So what we did is we provided a 1-day training that was really a broad training on how to implement evidence-based health promotion programs. So this would be how to identify these programs, how to adapt them to your situation without losing the elements that make it effective, and then how to do an evaluation. Then we also sort of had an overall orientation to Step It Up Survivors. We included a webinar on how to train and recruit walking leaders. Then we held monthly webinars that really were a facilitated discussion on the implementation of the steps, the 7 steps. So for example, discussion about recruiting and retaining and keeping walking group leaders and members motivated, as well as how to make adaptations. And then we also provided guidance through phone calls and emails. So our evaluation focused mostly on implementation outcomes rather than changes in the participants in the walking groups. And the community organizations completed monthly and final report. And in there, they described sort of their implementation. So they talked about, for example, strategies they use for publicizing Step It Up survivors, tactics and incentives they use to keep people motivated and engaged. They described their walking routes. Also, they gave information on the number of groups they held within their area and attendance at each group. Then we also conducted an observation of each group walk just to see how those were running. And we interviewed the organizational leadership at the time we were out there. And then the organizations also completed a log to record any adaptations or changes, that is, that they made to the program. And then cancer survivors were invited to complete online surveys at the beginning of when they entered into the walking group 3 months and then 6 months later. So for our analysis, we, for the qualitative data from the monthly and final report, as well as notes we had from our observation and interviews, we coded those focusing on implementation outcomes and barriers and facilitators to implementation. And then we put our coded passages into an implementation outcomes matrix for further analysis. And then we also ran some descriptive statistics using the STATA program. So now I'm going to go into the implementation outcomes. So the first one, we're looking at adoption and acceptability. And acceptability, what we're looking there is just the perception among the organization and the participants that this program is agreeable, satisfactory to them. And what we found here were, there were 10 organizations who responded to our request for the proposals with that special call, and we funded 8 of them, and 6 of them were in rural areas. 30 cancer survivors who were participating agreed to complete baseline surveys, so they did complete them, and then 17 of them completed the surveys at 3 months and 6 months. And at 3 months, what we found from the respondents was 16 out of 17 of them agreed or strongly agreed that they were satisfied with the walking leader, the walking routes, and the program. And at 6 months, that went up to 100%. And then 6 of the organizations reported that their participants enjoyed the program and that the same participants kept returning. And that they did develop sort of a connection with each other in the group and were supportive of each other, sort of had this core group. So if we look at the average weekly attendance across the 6 months, first there were 258 unique participants who came to at least one walking group. The median number of participants across the organizations were 34. The average weekly attendance was 14. And as you can see, there's a variation. There's some organizations who had lower attendance and kind of struggled. There's some where it varied over time and some with a little bit higher attendance. So then we looked at appropriateness, which is really looking at the perceived relevance or fit, again, for the organization and the participants. And 5 out of the 8 sites reported their participants experienced increased physical activity. They reported to them that they noticed health benefits. That might be improved sleep or more energy. And they also had they noticed this connection and engagement among the members. And at 6 months, the respondents on the survey, 15 out of 17 of them reported that they agreed that the program helped them increase their physical activity overall. And all of them agreed that the program was a good way to be physically active. And 16 of them reported that they did feel connected to other members and supported by other members of the group. And 5 of the organizations in their reports reported that participants wanted the groups to continue after the end of the project. So now if we look at feasibility, the main challenges that the organizations reported were recruiting and maintaining engagement of the walking group members and the walking group leaders, working with their community partners, and then keeping up with grant requirements. So 3 of the organizations described challenges with recruiting participants, which we saw in those graphs. 5 of the organizations actually expanded to include members of the community who weren't cancer survivors, friends, or families, just to enhance that. And strategies they use to publicize the walking groups, word of mouth and social media and placing posters around the community were the most common, but other ones that were used were working with local media, incentives, or working with their community partners. And all the organizations held their walking groups outdoors. 4 of them were able to secure an indoor location that they could use during inclement weather. So if we look at fidelity, which we're defining as the degree to which the program was implemented as delineated in the toolkit. So we found that ranged from 62% for step 1, which was community engagement, to 86% for step 6 is organizing the kickoff. And across for each organization, the range of fidelity across the steps ranged between 64 to 90%. And the number of adaptations an organization made ranged from 0 to 4. The most common were made to aimed at increasing reach, receptivity, and participation. So an example of that was a few of the organizations increased the frequency of the walk from once a week to twice a week, basically based on the interest and request of the participants. We did ask the organizations to talk with us about their adaptation in advance so that we could make sure that they weren't going to be impacting the evidence-based components of the program. And for the most part, these discussions took place. In a few cases, they did not. And so we weren't always aware of that adaptation until the end, till later. So if we look at costs, all the organizations reported implementing the program as planned within the budget. So recall they had a $15,000 grant, but they also received in-kind donations from community partners to help with implementation, and that included volunteer hours or free space or donation of time for things. The number of groups each organization had ranged from 1 to 9, with on average they had about 5. 2 reported incorporating their walking program into an existing organizational structure, and 1 reported that they co-promoted it with a well-known wellness program, which contributed to how successful they were at recruitment and maintaining that program. Now, our grant did require that they use $1,000 of their $15,000 for participant incentives. So that might be like raffles or promotional products. And the organizations reported that these participation incentives were really an important element in the program's success, and it also made it fun for participants to participate and keep motivated as time went on. Now, finally, if we look at sustainability, 4 of the organizations reported their programs were highly likely or somewhat likely to be active 1 year after the funding period. And the main reasons for these were that they had integrated the walking program into an existing structure or programs within their organization, and then the amount of participant enjoyment in having these walking groups. And another factor was that volunteers were used to lead the walking groups. So quickly, if we conclude on that, we realized that organizations varied in their capacity to achieve success. So as we saw, some organizations kind of struggled to recruit and maintain participants. On that graph, they were a little lower down there. And that suggests the need for more tailored technical assistance to the situations of these different organizations with the context in which they are working in. We also saw variance across the organizations in fidelity with the toolkit, suggesting maybe we need a little more clarity about the importance of fidelity and how to balance that against adapting to your local conditions. And that's kind of tricky to balance those. And also sustainability was really more likely if the program was incorporated into an existing structure or other programs in the organization. And what also drove that sustainability was just the enjoyment of the participants who were participating in it. So now I wanted to shift gears and talk about our current project, which is where we call it our Rural Libraries and Walking Project. So, of course, you all are here with the library, so you may know a lot of this information, but just to review, public libraries are more increasingly acting as community hubs and offering a variety of programs, more than just what we think of them as a place for information. Um, um, but often they can lack the capacity to implement evidence-based health promotion programs. Although in a recent survey, 32% of city libraries and 13% of rural libraries reported offering some type of physical activity class, most commonly yoga. Some also did like walking, story walks. And but in offering these programs, typically how the evaluation is sort of ends with attendance, counting how many participants attend. And so for this Rural Libraries and Walking project, it builds on the Step It Up Survivor program that I was just talking about. And what we really wanted to do was expand reach into rural communities in Oregon. And we're working with rural libraries because of their interest in expanding and doing more health promotion. And also because in most rural communities, there is a library. And so what we're running is a comparative effectiveness trial. And we are comparing the effects of the walking program Step It Up to libraries who are implementing Step It Up plus a civic engagement program that we call Change Club. And that program is aimed at, it teaches participants how to work with their community to enhance walkability in their community, sort of bring about that change to improve walking for people. There are 18 libraries participating in this study, and they were randomized either to deliver the Step It Up program or the Change Club Step It Up program. And we are evaluating change in the participants. So we're looking at their change in fitness and amount of walking, as well as some other factors. And then we're also conducting an implementation evaluation similar to what we did for Step It Up survivors. We were awarded a 4-year grant from the National Institutes of Nursing for this study. Well, it was actually awarded to the School of Nursing. And the actual walking program is 2 years. So it started in the spring of, or late spring of 2023, so May and June, and it goes to May and June of 2025. And that's the list of the collaborators here on this project. So the Step It Up program, so similar to the Step It Up Survivors, this is a weekly program for 60 minutes. It starts with a group discussion or check-in each week. It's followed by the walk, and then it ends with brief stretching. The leaders, which use team building strategies to help build this cohesive group. Each participant receives a t-shirt so that the group actually comes up with a group name for their group, and then that we had that put on their t-shirts, and so they have those group t-shirts. And we do that because research shows that that really does promote a sense of belonging and identity, which really improves adherence to, you know, showing up each week for the walking program. And then each participant was given a Fitbit for self-monitoring, again, which improves motivation if you can kind of watch how you're doing. And then we have it structured so that the librarian leads the weekly walk for 6 months. And then at that point, it transfers over to a peer. So one of the group, walking group members sort of leads, so it's peer-led from then on, really to try to enhance the likelihood of sustainability over time. Now the Change Club Step It Up program, so they do the same walk just as I described, and then afterwards they meet typically at the library for 30 minutes for this civic engagement or Change Club portion. And for the first 6 months, what they were doing is following a curriculum. It was a week-by-week curriculum that focused on the group learning how to establish a purpose, how to assess and discuss town assets and barriers for walking, identify needs in the town. And then the group really came down to identify a project that they could implement in the town. They developed an action plan, learned how to delegate tasks to the different group members, how to kind of keep track of all of that. And then each group was given $5,000 to use for their civic engagement project. Again, that's focused on enhancing walkability. And then the group developed a plan and a budget with that $5,000. Currently now they're working together on completing that project. They're at various stages of completion of their projects. But some examples are, some have developed these very beautiful, colorful walking maps that describe certain walking routes in the community. It's both printed and then you can look at it on the library website. One group had put prominent signage with lighting over a crosswalk in a very busy street in town. And others are going to like farmer markets and have booths that really talk about the importance of walking and sort of promoting walking in the community. So we are providing support for the libraries. So we have a toolkit. You can see it looks pretty much the same as the other one, except it's just Step It Up. And that we did adapt from Step It Up Survivor. So it's a bit of a different toolkit, but some of the material is the same. And then those who are in the Change Club received this curriculum. It's like a week-by-week lesson plan of what to talk about and how to structure that 30 minutes. Then we sort of held some initial webinars to talk about Step It Up and Change Club, how the programs were developed, how to run the program, sort of an overview. And then we held monthly webinars with the librarians. And these webinars, actually, the librarians were divided into their two groups. So we had the Step It Up group and then the Step It Up plus Change Club. So they meet separately. And the reason for that is, again, we're comparing the difference between these two groups on our outcomes. And so we don't really want a lot of interaction of the libraries from these different groups, the librarians, because that could impact how they run their groups, which ultimately could affect the results of the study. So for now, we sort of have them as separate groups to try to minimize that interaction, which could impact results. So we hold those webinars, and then we did have one webinar about how to identify and train your peer leader, again, which is taking over after 6 months. And now we hold those webinars with the peer leaders. Then we did send a $5,000 check to each library at the beginning of the study, sort of to help offset any costs for implementation. We realize that probably doesn't really offset all the costs, but and then we're available to them by email or phone when they have questions or concerns or other things. So now we have 9 steps. You see they're a little different than they were for the other program that we developed. And prior to starting actually working on and we're going to go through these steps in a little more detail in just a moment, but what I wanted to start with was prior to starting implementing the program, or even step 1, the librarians needed to go through a human subjects research training. It was online. It took them anywhere from 8 to 12 hours to complete that training, so it was pretty intensive. And that was because since they're interacting with participants, the Institutional Review Board, or IRB, considers them part of the research team, so they needed to have all that training. So that was an added amount of time libraries weren't actually expecting. So we were grateful they did that. So now if we go to the steps, for the first step, most of the librarians worked with existing community partners. They also developed some new partnerships. And then they did spend time selecting and mapping routes. They would walk the route to time it to make sure they could get it done in that time. And they were really paying attention to safety, accessibility, and aesthetics when they were planning these routes. Some of them used that app, map their route, and so they could print out maps for participants. Now the publicizing and recruiting participants, this took place over 4 to 5 months. We had a target of 18 to 20 participants per group, per library, and we had that high number, which the librarians did let us know was a high number and was challenging to meet because we needed to take into account attrition over time, and we wanted to make sure by the end of the 2 years we still had a sufficient sample size for our statistical analysis. So what was different in recruiting, because this was a research study for these librarians, was just the focus on that it being research. So they needed to follow an approved protocol. They needed to use IRB approved documents. and there was very clear steps they had to use for recruitment that included screening participants for eligibility. Some of them needed to get health provider release forms signed, and the librarians had to have a log to keep track of all this at each step, as we need to report all those numbers. So that took a lot more time than they thought, and it was very different than their usual recruitment approaches, where people can just come there. The participants had to commit to 2 years to be recruited. That was also, they couldn't just kind of come and go. So they did, as I mentioned, work with existing community partners. They also developed new partnerships. And for example, some of them were guests on a local talk radio show, or they held informational sessions. And certainly they had brochures and posters that they posted, and other means that they usually use to recruit for people for their library events. We provided assistance as needed. So the librarians were able to enroll 330 participants with an average of 18 per library. At 6 months, we have an 86% retention rate. And at 1 year, we have an 81% retention rate. So right now we have about 270 active participants, which is fantastic. Now I want to spend a little bit of time talking about the weekly walks, which are the remaining steps in the toolkit. So the first walk, that which is the kickoff, that walk really started with trying to build rapport of the group. The group set group norms, and then they were also guided in how to develop SMART goals, SMART being specific, measurable, achievable, relevant, and time-bound for their physical activity. As I mentioned, the group then decided on a group name. They were also given some welcome kits that included handouts, like, for example, on the benefits of walking and stretching exercises. Then they had their Fitbits. And then by then the group had time to go on a short walk, and then they regrouped for stretching. And after that, the group starts with the check-in, then walking, and then ending with the stretching. And so the check-in really, what they're doing is checking in on how people are doing with their goals, and also talking about barriers or facilitators that participants might have for walking. Obviously, they talk about their successes or any benefits they're noting from physical activities. Now, many of the librarians talked about how they do try to check in with each individual participant on their goals. So in the walk, they might try to walk with different people to check in with them. Some were able to do this more than others. Really, it depended on the walking pace of the members, the way the route was structured, how well they could do that. Then the librarians also did talk about challenges they had. One was that people walk at different paces, as we might anticipate. There are slower walkers and faster walkers. And how this was addressed, they discussed in some of the webinars. So in one way, if it was like an in and out route where they walked out to a certain distance, turned around and came back, how they sometimes dealt with that was the faster walkers, of course, would get ahead, but by the time they turned around, they would then meet up with the slower walkers. They could be together for a short while, but ultimately they all kind of ended up back at the starting point about the same time. Others talked about something kind of like a leapfrog, where the faster walkers would walk ahead, then they would circle back, meet back up with the slower walkers for a short while, walk back ahead, then circle back and meet with them again. And then in some cases, what they did is they just divided up, in all the groups, they had people always walking with at least one other person. And so in some groups, they would have the slower walkers and the faster walkers. 1 week they would walk together, and they would kind of mix up who was paired together. So sometimes the faster walkers walked a little slower. Other times they were other fast walkers. But that way, all the group members got to kind of chance to interact. Of course, another challenge they reported was keeping participants motivated. So things that helped with that is we had a 6-month incentive that most of them actually tied to a benchmark. So once you do a certain number of walks, and you can get this thing. And they found that helpful. They also changed up the routes so that it wasn't the same, and got input from the participants about what routes they might want. They also found calling people who didn't show up was helpful, letting them know they were missed, and trying to see, what might help them be able to come back. We did provide a sample script for that in the toolkit, which some used. And then also they found just accommodating people who might be gone for gaps of time due to travel or illness or surgery, and bringing them back into the group and getting them reintegrated. Another challenge, of course, as we can imagine, is weather. Some were able to find indoor locations, and others have really struggled with being able to do that. And about the group support and cohesion, the librarians have reported that the groups are very connected, and they talk about them supporting each other. Some have described checking in if someone misses or has an illness to see how they're doing. And they have created these sort of group chats, or some have Facebook groups and whatnot, where they keep in touch with each other as well. And some are walking together on a different day in addition to the group walk. And some are doing things also like having coffee or potlucks or other fun things with the group, sort of as they really develop these friendships. And the T-shirts in the group name the librarians reported do seem to have help with that sense of belonging, actually developing a sense of pride in their group. And if we look to the peer leaders now, as I mentioned, we had this training to help how to train them. We also provided a peer leader handbook and then a backpack. The backpack actually also provided one to the librarians, and in there is a like a small first aid kit. And then the idea is they're going to carry some snacks and water in case people need those. And we're holding webinars for those peer leaders every 3 months to check in and see how they're doing. Peer leaders were asked to commit for 6 months. And for most libraries, that has worked out well. In many cases, they're co-leaders. In some cases, there's some challenges with that. But overall, that seems to be working well. And of course, the goal there was to reduce the amount of time the librarians needed to be spending. And these peer leaders, beside leading the group, they do kind of keep track of these group texts, and they're communicating with the group and checking in with people who miss or don't show up. Now I wanted to take a minute to talk about data collection. So we are collecting data at 4 time points. And we first data collection we did was before the participants started the program. Then we've collected data already at 6 months and 12 months, and we will at 24 months, which will be next spring. And so what we do is we create these data collection events at the library, and the librarians are helpful in organizing that. And then we, the research staff, come in to help collect the data on these participants. We've actually collected have stations. And the picture on the bottom there is our research team, where the library had a conference room, and we were able to set up our stations, as it were, in that conference room. And in another library that was much smaller, our stations were scattered around the library amongst the books. What we did is we had a field test, 6-minute walk test, which is a field test of fitness level. We also have them completing surveys online that ask a variety of things, like their physical activity level, support from friends and family, their perceptions of their neighborhood. We also ask them questions about civic engagement, because we have the civic engagement program. Then we do measure their height and weight. We measured their waist and hip circumference and their blood pressure and pulse. And then at the beginning and then the last time point, we're also measuring their cholesterol and a blood test that measures for diabetes. It's called hemoglobin A1C. It measures the average blood sugar over 3 months. And then we've given each participant an accelerometer. And in this case, it's just a red square that's on a wristband. So it's measuring movement. So much like a Fitbit, although they can't see anything, there's no buttons to press, they don't get any feedback on what's being recorded. And then they return that to the librarian. The librarian mails them back to us. And it is amazing. We have received every single accelerometer back. We haven't lost any, and none have been damaged, which is quite extraordinary. In fact, when I talk to my colleagues about that return rate, they're pretty impressed because you usually don't get 100% back. And then we have timed how long it takes for these participants on average to be at the data collection event, which is an hour. And the reason we've done the blood testing only twice is that it did another 30 minutes, making them there for 90 minutes. What I wanted to take a minute was to talk about data collection you might do if you were running this program in addition to attendance. So one is you could create a survey that could be done online, at the library, or a link people could do it at home, that really could ask them about their experience with the program. It could ask them about their walking and physical activity, what they're doing, any changes they may noticed, for example, improved sleep, and other kind of questions to get more feedback on how the program is working for them. So that was one thought I had. And then finally, I wanted to just end with, we're also doing, as I mentioned, the program evaluation, implementation, and that involves, we have some surveys the librarians are completing about the implementation of the program, how long it takes them to do things, the feasibility factors that are making it likely that they'll be able to sustain the program. We also interviewed the librarians and participants to get their experience. And we've also conducted observations where we went out the first summer in 2023, and again this summer, to observe a walk and the Change Club session. I wanted to stop there so that we have time for questions and discussion. So thank you for your attention. And I guess we can start with any questions if there are any.
Thank you for that presentation. That was wonderful. Let's open up the room for questions. I'd love to see your questions in the chat box.
Nora, this is Rebecca. While people are typing, I just want to add something, because Cindy mentioned, they started out with a grant, which I believe, I'm sorry, it was not from NNLM, but I do want to promote a future class that we have coming up in February, which is how to apply for NNLM funding, because the regions offer funding for projects, potentially exactly like this, or some other type of project that you might be thinking about for your organization, whether it be a library or some other organization. So I just put that link into chat.
I don't know if I should stop sharing the screen, if that would be best, Nora.
Either way, I see we've started to get a few questions, so keep those coming. One person asked, do you have ideas for how this kind of program can be sold to community workers, community integrated health, national diabetes prevention program, lifestyle coaches, clinicians, etc.?
How doing a walking program? Yeah, I think there's a lot of evidence. As I said, a group walking program is an evidence-based program, so we know it is effective. This particular study we're doing, we're comparing that to adding civic engagement, to see if by adding that component where the group really becomes much more cohesive, that's our theory, because they're working together to complete this project, that they might have even better improvement in their physical activity than the group walking programs. But I think going back to promoting it, it is evidence-based. We do know that it does make a difference. And so I think that's how you can promote it, is that we do see that it does improve health. I mean, that there is strong evidence to support that, and that it also builds community. Some of the librarians talked about how the walking group members weren't necessarily patrons of the library and have become patrons of the library. So that's also an added benefit. And I think they've noticed, it makes the library more visible when people are walking around with their group shirts. They're asked about what's that's about. And so, these civic engagement projects are also making a difference. The library hosts, as I was mentioning, if they have the walking routes or maps on their website, which is going to, of course, draw more people to the library website, where they then might be interested learn about other things going on at that library. So I think. And overall, they are cost effective. I mean, I think we all know with volunteers, there can be challenges. We have found by trying to get them to have a 6-month commitment and provide some support to them, that's working well, again, for most of the libraries. I'm not sure if that's answering the question.
Someone else has sort of a follow-up to that, which may be similar to say, I would like to team up with healthcare providers to do this. What is the best way to approach them? Do you have
Oh, that's a
anything
great
to add?
question. Yeah, so I think I would meet with the clinic leadership if it's a clinic, and talk about working together to on a group walking program. Again, for the health providers, it's letting them know that it is an evidence-based program. It is recommended, for example, by the CDC, the U.S. Preventative Task Force. So the Community Guide, which is another, people may be familiar with the Community Guide, which is just all evidence-based programs are there. So walking programs are there, group walking programs, and talk about how that can really help improve their patients' health, depending on what they're working on. And in general, they're very safe. There is a physical activity readiness questionnaire that you can find online that we used to assess people's readiness. And all that did was if someone had specific chronic illness, like it was a low bar. So even something like high blood pressure, they needed an okay from their provider. But of course, if you're teaming up with them, then they can let you know, yes, these people are fine. We don't need to worry about some rare cardiac event happening on the walk. And they are safe. I mean, we have had very few falls, and if the ones we've had have been minor. So I think you can promote it as effective and safe. It's a way that they can improve their health, and it's fun. People enjoy it. It's actually fun, and that helps them stay motivated.
Yeah. I know you mentioned weather briefly. Someone else does ask, did participation suffer during extreme heat or weather events if they occurred? Can you share any information on how changing climate conditions are impacting walking and outdoor activity?
Yeah, that's a great question. Yeah, I haven't looked in detail, I'll have to say, at the attendance data. They do record it every week. There were some challenges. So for example, when it was really hot, or there's the wildfire smoke here in Oregon, we have that problem. Some parts of Oregon, of course, they had more issues in winter with snow and ice. Other parts of Oregon do not have that problem. They might have other stormy weather. For some, they were able to find an indoor location. In some cases, it was actually a business, like a big, I think in one case they used a Home Depot store to walk indoors. That is a bit of a challenge. I think they really all tried to find an indoor location and had some challenges with like, let's say it was the school district or something, legal concerns about liability that created some issues. So that was a bit challenging. And so I think, yes, going forward, we do want to think about how can we have indoor locations that are accessible for use for walking groups for when, there's poor air quality or some inclement weather, so that people aren't putting themselves at risk in order to go out and improve their health.
Here's an interesting follow-up question to that. Is walking in place during bad weather as effective? A PT recommended having people walk on special mats.
So the special mats I'm not sure what those be, but they are sometimes some that help with balance. So yeah, I think if you were able to walk in place and keep your heart rate up and have a moderate intensity level of exercise for the 30 minutes, you would get that benefit. I think the challenge is keeping people motivated to walk in place for that long. Certainly you could use music or other things. But I think it's, in that sense, as long as their heart rate is up for that same length of time, it's just as effective. It's just people get bored.
I'm glad to see we're getting more questions in the chat. Someone asks, this is great, yes, walking is good not just physically, but also emotionally positive for us all. How could this be implemented in places like rural Alaska, where only 10% of roads are paved?
Yeah, that's a great question. And you can find walking routes that are safe that aren't necessarily paved. I think then you do have to pay attention to, um, how much unevenness is there uh, for concern about people falling. But some of these walking groups are doing, I mean, I know this picture here of this walking group, they're on a sidewalk there, but there are some who have done them more on gravel trails in the area. So I think you can do it. It's more uh, uh, going out and looking at the route yourself to see, does it seem fairly safe? People could walk around. Of course, you want to make sure as far as traffic, that they're safe from traffic. But you can walk out on routes that aren't paved. Then, like in Alaska, of course, in the winter, you're going to have the snow, and either you participants are able to wear boots and gear up properly, or then you would want to try to find something indoors. But some of these walking groups have just accepted walking in the rain, and they've kind of geared up for the rain and walk in the rain with, rain gear.
We have someone asking, is there a database or list of other libraries that are doing this across the nation?
That's a great question, and I don't know if there is a database. I know there is a researcher. His name is Noah Lenstra. He is at University of North Carolina, Greensboro, and he does follow what programming libraries are doing nationwide related to physical activity. Unfortunately, I don't have his email address off the top of my head, but I'm sure if you Googled his name, Noah Lenstra, Lenstra, University of North Carolina, Greensboro, you would get his faculty webpage, and you could certainly email him, ask him. He does keep a whole database of that, but I don't know that he has it published somewhere.
Someone else asks, are you hoping to publish your findings? If so, when and where?
Yes, we are hoping to publish our findings. So as I mentioned, this is a 2-year project ending in May or June of 2025. Some groups ended in May, some in June. It's just they didn't all start on the exact same day because we had to do data collection first. And then after that, we'll be running our analysis, which is a longitudinal one, looking at change over each of the time points, looking at the trajectories of change and that sort of thing, and the difference between the two groups. So we would hope that those publications would start coming out, early 2026. But we are also going to be putting together, and those are in, peer-reviewed journals, but we are also planning to put together sort of one page, like an infographic kind of thing that can report the results that we will be sharing with all the libraries. And we can certainly share that information more broadly than just our 18 libraries. So people have access to that as well as our peer-reviewed publications, which, as we know, that takes time.
Yeah. We've got one question here asking if you can say a little bit more about the civic engagement piece.
Yeah, so I'll say a lot of the libraries were really excited about doing the civic engagement piece. And I will say that those libraries randomized to Step It Up will get that information at the end of the 2 years, so they'll have that. And that is a program, that curriculum that was developed by a researcher who is now at Texas A&M University. And as I said, it's a curriculum that really walks through week by week, and it's going through the process of how to teach a group to assess a community, what's available for walking, where are their problems, what are the challenges, and helping them figure out how to decide on a project that's reasonable, that's doable, and how to work together as a group to delegate tasks. So it kind of walks through that step-by-step process. And it's called the Change Club. I think the developer is in the process of making that more available to librarians, but if there are people who are specifically interested in that curriculum, I have my email there. If you could send me an email, we can follow up to see if that is available or how you might have access to that. But It is really about teaching people how to work with the key stakeholders in their community to bring a change about. In our case, it's to improve walkability. The Change Club overall really focuses on physical activity and nutrition, but we narrowed it down for this project to walkability.
Wonderful. I think we have time for one or two more questions. We're ending and it looks like we have a few in our chat box. This one is sorry, where is it? Is this program similar to Walking with Ease? Do you know that program?
I'm not familiar with that program, I'll have to say, Walking with Ease. So this is really, it's a group-based walking program. So the idea is you're getting a group together because that, as I mentioned, brings support and camaraderie and kind of feel accountable. And they're just walking, really trying to get up to a moderate level of physical activity. Again, there are limitations. Some people aren't quite able to get as fast as others. But it's really just walking together to support each other and walking. So the Walking with Ease, I'm not sure what that program is, so I don't know how similar it is. But this is really focused on building that connection of the group.
Thank you, Dr. Perry, and thank you for everyone for being here. That was a great presentation.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.